my specialty is orthopedic spine surgery. So I got my training in Hong Kong and back in 2004. And then when I first come here, I started the spine service here. And then my main interest, of course, is the minimum invasive spine surgery. This is a trend now. So the first thing patient asks me, is it safe to do the spine surgery? Because they have heard so many noises at the background. They do not do any spine surgery, cause paralysis, that kind of things. I always ask the patients how frequent you see the paralysis. And then I will always reassure the patients that all this surgery, in fact, is lower than the risk of traveling in your car. So with the advance in technology, we can use the technology to help us to achieve what we want to achieve by doing smaller incisions, a more accurate placement of the instruments, and also reduce the risk of the surgery. At the same time, faster recovery. So most of the patients, if you talk about spine surgery, they can walk on the same day, during the same day. Morning you do the surgery, in the afternoon you are able to walk. And then they don't have much pain. And of course, the risk of the spine surgery is much reduced. So we set up the nerve monitoring system. So the system will tell us the locations, the safe entry point of the surgery. Okay, all these are to improve the safety of the patients. Yeah. During the surgery, we want to make sure we do not damage the nerve, because as you know that the nerve is inside the spinal canal there. So when we do all this instrumentation or decompressions, we want to know that exactly where's the location of the nerve, and then when we approach the nerve, so the system will tell us we are approaching the nerve. So if we are touching the nerve, the system also will tell us you are touching the nerve. All this to ensure the safety of the surgery. Then with the help of the AI, we don't need to repeat the similar X-ray exposure. Using the artificial intelligence, so the machine will tell you how to position the screw, whatever instrument at the direction that you want, rather than keep on shooting the X-ray to guide us, all these things.
I'm a spine surgeon. I have worked as a spine surgeon for the last 10 years. Right, I specialize mostly in all forms of spine surgery that include can be a simple slip disc, to like spinal instability, spondylolisthesis, to even spinal deformity like severe scoliosis, or even like kyphotic deformity, as well as other forms of spinal condition, for example, spinal infection, or even spinal tumor like metastasis to the spine, cancer that spread to the spine. Yeah, we treat all forms of spine condition or disorder, yes, in the hospital. Because we brought in specialized equipment just to ensure that all these surgery are performed safely, right, and very accurately, right. In the equipment we brought in include, say, like computer navigation and 3D CT scan in the operating theatre. That means during a surgery, we can get a 3D view of your spinal structure, right? All our screw that is placed is very exact, right, using navigation. And the other type of equipment we're talking about is a neuro monitoring. That means during the surgery, the complication most people are afraid of is paralysis, right? Injuring to your spinal cord, and you can end up with being in a wheelchair, your leg cannot move, right? So with this neuro monitoring, we actually put some probe in your leg, and during the surgery, this helps us to monitor your nerve function, right? And it's very sensitive. Imagine we just touch a nerve and the machine actually picks it up. So that makes it a very safe surgery.